I've spent a decade taking a bite out of conspiracy theories, unraveling urban legends, and grappling with worldwide top secret issues.
I've even racked up some of their awards.
All while ferreting out the bottom line.
On all topics, controversial, bizarre, and taboo. Interviewing movers and shakers, agitators and muckrakers.
That doesn't answer my question. That is all I'm answering.
With me, Cary Harrison, as your guide.
3, 2, and...
Harrison with you. This is Go Harrison, broadcasting on a variety of FMs up and down the west coast of California, as well as live streaming here and there. We're going to talk a little bit about medicine today, because how many commercials do you see when you're watching for ED? And that's not a nickname for Ed. It's for erectile dysfunction, which can happen as you get older, or maybe you have diabetes. Well, people get these. They tend to work, but it depends where you want to put it. Will your penile implant break if you want to put it in this hole or that hole? We're going to talk about that hole today. And who better than... Well, boy, I have to be careful how I introduce you. We're going to introduce to you right now Dr. Robert Cornell, and he's a ED expert and urologist. He's in Texas right now, and he's probably the go-to expert for penile implants as a urologist. And Dr. Cornell, I want to welcome you to Go Harrison.
Thank you very much for having me.
Now, we're talking, I think generally when people think of a penile implant, they think about vaginal insertion. That's the common understanding. But if we look at 10% of the global human population, maybe even 30, you'd actually know what those real numbers are. It is a true fact that both sides are getting equal amount of action. The penile implant, it bends, it snaps. Is it safe?
It is safe, and it does not break. You can put this in fur, and it's very reliable. In fact, it's even better than the real thing in the sense that it stays hard even after you climax, regardless of the hole, regardless of how it's being used, until you want it to be soft. So for those 30 million American men of any sexual preference who have erectile dysfunction, 10 million of those men, 1 in 3 with ED, are going to fail pills like Viagra or Cialis. Those are the patients that we're trying to talk to today who have refractory erectile dysfunction for which pills will not suffice. Those are candidates for a penile implant, which is a 30-minute operation in my hands. It can be done as an outpatient even. It's done through a single incision, and a 3-piece inflatable implant is placed that will allow a lifetime of regular, reliable, complete erections that you can completely control.
Now, how do you trigger an erection with an implant? Is it neurostimulated? Is it a pump? How does that work?
It's a 3-piece mechanical device filled with saline. And when one wants an erection, he reaches into his sac, reaches down to his scrotum. In front of the testicle, nothing is removed. In front of the testicle sits a little thumb-sized pump that he will squeeze mechanically, which will transfer fluid from a small balloon reservoir that's put in his pelvis beside his bladder, transferring that fluid, which is saline, into 2 inflatable cylinders that go in the shaft of the penis. Again, all of this is buried inside the body. No one knows that you have it. You can have an MRI. You can go through airport security. There's no metal components. And the sensation of the erection and the ability to urinate and ejaculate is all unchanged. And it's more rigid than even the best natural erection. And it's reproducible, reliable, and you can inflate, deflate as often as you like.
Let's cut to the chase. I just want to make sure your thumb isn't over your microphone there, because it's getting a little muddy sounding here. We're talking, and the original point of this interview was, it turns out that there are tens of millions of Americans who have anal sex. It is a fact.
Sure.
Straight, gay, doesn't matter. Not discussed, ever discussed, is that it's always vaginal penetration. Given that there are tens of millions, with ED, the population continues to age. So therefore, it is a more necessary treatment, just like the military pays for Viagra to the tune of, 87 million or some crazy amount like that. That said, anal sex with a penile implant. A vagina is a much softer organ, generally speaking, than possibly... why am I having troubles talking about this? please.
This can go in any hole you like.
Yes.
Go in the old oak tree out in the backyard. The beauty of the penile implant is that it's reliable, it is safe, it is the best erection that you'll ever have, and it can go in any hole. That does not increase your risk of device infection. It does not decrease the effectiveness of the implant. The implant does not decrease the sensation during intercourse. This implant, it's still your penis. You can do with it what you would love to do before you had erectile dysfunction. There are no physical or sexual limitations to the penile implant.
And what about the orgasmic response? Is it limited because there's now extra mass in there?
No, there's not. It's not. Instead of relying upon defunctionalized blood vessels and nerves that over time, the wear and tear on our arteries and nerves after prostate cancer surgery or radiation with chronic diabetes or high blood pressure, or men taking their blood pressure pills, the blood vessels just aren't carrying sufficient blood pressure to the penis and maintaining that blood in the penis to allow for a satisfactory erection. The implant simply replaces the need to have blood fill the penis with these inflatable saline-filled cylinders. And believe it or not, through this one incision, this entire device can be placed, and it does not change the sensation of sex. It does not change the ability or the sensation, the enjoyment of the orgasm, or the urinary stream one bit.
So instead of having the natural corpus spongiosum and all these other wonderful, the vas deferens between all the different tubes running in and out, we're talking about a permanent solution. And one question, because I don't ever get to talk to urologists, but everybody is fascinated. There is going to be a population going, anal sex, why would anyone have that? It's a mystery why somebody would do that. It is true that it feels good, but people don't understand why would that feel good. The prostate, which is sort of the culprit in much of this ED situation, and many times, is that the source of the male orgasm?
The source of the ejaculate volume comes from the seminal vesicles, which sit on top of the prostate like little rabbit ears. 85% of the ejaculate volume comes from the seminal vesicles, another 15% from the prostate. The semen that come from the epididymides or the testicles really does not contribute significantly to the ejaculate volume. So we're talking about the prostate and the seminal vesicles on top of them that contributes to the ejaculate volume. And none of that is changed with the penile implant. Really, this is still your body. It's still your penis. You're just not relying upon blood to give you the erection. You're relying upon the implant. So none of that changes. And whatever you like to do with the penis, you can do it with a penile implant inside your own penis.
How does the orgasm actually work? What are the mechanics that create that sensation? And is the prostate itself connected to the orgasm?
It is. The prostate and the seminal vesicles that provide the ejaculate volume are connected to the urethra, the tube that you pee out of, through the ejaculatory ducts. And when the sympathetic nervous system fires, it is contracting the muscles that are connected to that, as well as around the urethra, squeezing that fluid and allowing it to emit forward and out the tip of the penis. So again, none of that is altered in any way, anatomically or physically or functionally, with the placement of a penile implant.
So as people get older, and by the way, we are talking to urologist and erectile dysfunction expert Dr. Robert Cornell. He's in Texas right now. He's really the go-to guy for this kind of surgery, which is as popular as boob implants. We find that unlike a breast implant, there is no saline leakage, there is no toxic side effect, and that it is a permanent solution for whatever the erectile dysfunction cause may be. As people get older, their ejaculatory response becomes lessened. The refractory period, the time between erections, becomes longer. As a 18 or 20-something-year-old, you can fire halfway across the room and knock the pictures off the wall. At the age where one might want to get, I know you're not allowed to smile, as one gets older and might have this erectile dysfunction, there is going to be less torpedic activity and splash factor. What is the reason for that?
Well, as we get older, that's a great question. I'm not so sure that age really influences the torpedic factor. Testosterone and our ability to achieve the same level of stimulation and sensation as our partner's age, and the the vaginal lubrication diminishes as our testosterone in the gay population. As the testosterone levels decline, which it will do 2% per year less, you will make 2% per year less testosterone after the age of 30. And testosterone, probably more than age or any other neurologic or vascular phenomenon, is responsible for the decline in maybe the enjoyment of sex and the torpedic ejaculatory sensation and enjoyment that we feel.
Just so you know,
and again, the penile implant doesn't change that. I replace testosterone in men with low testosterone, and when you increase the testicular level of testosterone and the blood level of testosterone, your libido, your sex drive, your energy level, the quality of your erection, and the enjoyment of your orgasm will improve.
My straight director has cocked his ear, so to speak, because this information is valuable to him too, to be sure. What about how it looks? We've got a tiny little pump next to the testicle. Is it a left or right testicle? Does it not matter?
It doesn't matter. I typically choose the left side.
So is this going to be visible? Because I don't imagine most men want to boast that they're getting a little help here. Like, people don't say, by the way, I took a Viagra. Check this out. It's my natural, hardened tumescing,
There is no way that anyone would ever notice that you had a penile implant unless you're walking around the YMCA with it fully inflated. There is no way that you can tell by inspecting the genitalia that a patient has a penile implant versus a natural erection. Even if your partner were to feel around down there, it would feel like you had an extra lump, maybe a cyst on the testicle. You're not going to see any evidence of a penile implant. There's no externalized components. There is no deformity to the scrotum or to the shaft. It looks, it feels, it acts even better than the real thing. And it really is. This is 45-year-old technology. So over the last 4.5 decades, it really has been perfected. The infection rate is less than 1%, and the satisfaction rate is well over 93%. Those 7% probably weren't counseled properly, maybe had an infection, maybe had a malposition from one of the doctors that really does just a couple of years. There's probably only 20 of us worldwide that do more than 100 penile implants per year. And clearly those are the guys that you want to seek if you're going to have this operation. You only want to do this operation once.
Well, yeah, once is probably sufficient, for sure. We're talking right now to Dr. Robert Cornell. He's in Texas. He's an expert on erectile dysfunction. He's a urologist, so his special beat, as it were, is to install these permanent cures in so many ways. I think it could be reasonably said it's a fix for erectile dysfunction, no matter the age, no matter the size of penis, no matter the probably level of issue. Again, all these wonderful puns, but it's going to work for pretty much anybody's business.
Absolutely, and it'll work for any cause of erectile dysfunction, whether it's a neurologic cause after a prostate cancer operation, whether it's diabetes or high blood pressure or the need to take blood pressure medication, whether it's low testosterone, which can be replaced. All of these things can cause erectile dysfunction, and the penile implant is intended for the patient for whom a simple medication, a simple pill, is not a solution. This is a 30-minute single incision operation that, with a recovery time of about 1 month, just internal healing for 1 month, you come back, I show you how to use it, and you can have a regular erection for the rest of your life. You're really only having any discomfort or any scrotal swelling for a week or two after the operation, and that's nothing that a jock strap and a little bit of ice or frozen peas on the sack will not handle. So you're talking about a 1 month bump in the road for a lifetime solution if you fail pills.
Finally, I was in Cuba, and I met a guy who was in their Cirque du Soleil system there and had done a high wire act and fallen and gelded himself, lost both testicles, but was still able to achieve a full erection, but obviously could not ejaculate, minus the testicles. However, he, according to Cuban medicine, he feels that within 5 years he's going to be able to receive a full functioning testicular transplant, and yet was able to achieve an erection at the same time. I don't know if he's a stud, a miracle worker, or what, but advancements are coming everywhere.
He may be a stud. He's an acrobat.
Yeah.
But the testicles will only do two things. They make sperm, which doesn't sound relevant to him, and it makes testosterone, which can be replaced exogenously. He can use an injection every week, or we can put a depot preparation in his buttocks 3 times a year. 3 injections a year will give him a normal testosterone and keep it steady for the entire year. He doesn't need a testicular prosthesis, a testicular transplant. He just needs testosterone replacement. And if he has erectile dysfunction with normal testosterone, which can be replaced, just like any other medication can be given, then he would be a candidate for a penile implant. And having him been impaled, the scrotum has plenty of capacity to handle this small thumb-sized pump that is placed in the sac.
Finally, what is the cost of this, and does some insurance cover it and handle it?
Yeah, Medicare does cover this. Most private insurance plans do cover it. We seek authorization from the insurance company before we schedule this, so there's no surprise bill at the end of the procedure. But if you don't have health insurance, or your insurance excludes the penile implant, it's about an $18,000 investment.
Okay. Well, I want to thank you, and thank you for also tolerating my rather sophomoric giggles, but this is not the... I'm, been talking about nuclear options in Korea and aggressive agonistic behavior, and I haven't actually talked about seminiferous tubules in a long time, so it's reasonable to be teenage-like in this conversation.
It's my pleasure, and I'd love to address the audience anytime you all would like.
Well, thank you so much for joining us, and actually the enlightened medical side of how stuff works, which is my favorite point. Like, why do you need it? Well, here's why, and that's really critical. How do we get in touch with you? There are going to be people who want to reach out and take advantage of this.
Sure. You can go to eddoc.net, to my personal website, learn more about the technology, learn more about me and my practice, eddoc.net. And if you want to find a doctor maybe closer to you, you can go to coloplast.com. That's coloplast.com.
All right, my friend. Well, thank you so much, and keep up the good work.
Straight up. Thank you.
All right. I'll talk to you later. Thanks.
Bye-bye.
Bye. Harrison with you. More to come, as it were.